Happy Sunday. Welcome to another episode of Woman Wiser. I'm your host, Sicken, and today we're going to explore some of the questions that I have been having and that I know many of you might have had about women's health in midlife. And I know there are so many questions coming up about this time of life, how we should focus our energy, what type of testing is necessary, what does a baseline picture of health look like, what does an advanced picture of health look like, and what do we need at this time? There's also so much information being delivered through social media, and so much of it is amazing. So much advocacy happening around these topics. I love it. I'm so happy to see that people are taking a stand to support our education and our knowledge. At the same time, it can feel like a lot, and it's hard to know what to listen to right now. As a 42, almost 43-year-old woman, my body is sending me so many different messages. Half the time, I don't know which one to listen to. Do we listen to the loudest one, the most persistent one? What if our testing doesn't reveal anything? Then what? It can be a really frustrating and challenging time of life. There are lifestyle adaptations that we may choose to make for ourselves. And then there's also the diagnostic perspective and how can we learn more about our bodies. I'm definitely coming into this period of life from the angle of someone who is tuned in intuitively and is becoming a little bit more data-driven. I could navigate the anxiety through some amazing somatic practices that I had, meditation as well. And the insomnia, I was able to make lifestyle changes to help myself with a lot of these things. But when it came to my cycle and when it came to the brain fog that I was experiencing and the erratic temperature swings, those were pieces that as they gradually over the last couple of years became more consistent, felt like, okay, now I need to start digging into some of these things. I run this podcast. I work a 9 to 5. I am in the gym every single day. I'm someone who likes to wake up in the morning and be able to get going. And I have a lot that I want to do with my life. And so not being able to think on my feet was really alarming, to be honest. And I think that was the thing that sort of kicked it into high gear for me. And I felt really motivated. And I felt like it was important to me at this time to get ahead of it. So that's the perspective I'm coming from. I want to acknowledge that there are so many perspectives of women stepping into this perimenopausal and menopausal time of life. And all of us look at this time very differently. We all experience it very differently. And as a health coach, and as I was building this platform, it was important to me to have a space to discuss them so that we not feel more alone in what we're going through. And you may not know that my partner is a naturopathic doctor. And so today, Gord is going to come on and he's going to talk a little bit about his experience with women's health. So we're going to get into that in this episode and talk about 4 core tests that you can do if you're interested in getting a more holistic look at a picture of women's health after the age of 40 beyond the regular hormone testing. We're also going to look at a perspective on why doctors might choose certain types of advice that may for some women feel limiting, why that happens, and then how a functional medical approach can be a game changer for women's health. This is really an area of life that I'm excited to educate myself on more, and as I do and go through my journey, to bring you all along with me. So at the end of this episode, when you're done listening, if you have more questions about what you'd like us to tap into, drop them in the comments. We'll do a part 2 and answer some of those questions. But for now, let's get Gord on the mic and let's dive in. It's a little family gathering.
Yay.
Everybody's here.
Everybody's here, even the kitty.
Okay, tell the people what you do.
I'm a naturopathic doctor with a background in exercise physiology, biomechanics, movement, and performance. So I would probably categorize myself a little bit more as a performance medicine specialist because I have that type of training, but also hormones, peptides as well, kind of added on to that. So
Yeah.
it fits into the longevity and performance medicine niche.
And you've also been on people's fertility journey with them as well and helped them get pregnant. So
That's right. So I have, training in naturopathic fertility, which is, without using things like HRT or hormone therapy, as well as training in hormone therapies, both for fertility, but also for perimenopausal and menopausal um, cases.
which is the world that a lot of us are living in right now, perimenopausal, and for some women looking at like fertility after 40.
Oh, for sure.
Yeah.
Yeah, there's a huge shift culturally to age of first pregnancy. The number of children families are having is going down. It is potentially a bit of an issue with people of our generation having less kids and the generations to follow us.
You mean
So
like from a population
from a
standpoint?
population standpoint, but there's clearly people that are looking to get pregnant later in life. And so obviously these, we're getting more and more patients freezing eggs, freezing embryos, going through that process. Um, so
Right.
how do you optimize your health and your fertility, egg quality, all of those things as you get, into your late 30s and into your 40s.
I feel like there's a dialogue around fear or language that is linked to fear around a 40th pregnancy. What's the real story behind that? What is
Well,
true?
I mean, of course, none of this is intended to be medical advice for everyone out there. Make sure you're having these discussions with your primary care and qualified physicians to do so. The thing with fertility medicine that I know is true, you know, every single person truly should have a different journey and a personalized one. So
Mhm.
that's where integrative and functional and naturopathic medicine is great. Yes, things like fertility and implantation and um, assisted reproductive therapy are basically cookie cutter for most people. But that's just the way that those protocols have been developed. But
Yeah.
outside of those very specific needs, it is very individual. So if you're 42 and having perimenopausal changes, but you're not quite sure, ask your physician about getting hormone tested or looking into repletion therapies for hormones at different parts of your cycle. These are the discussions that in the past would have been sloughed off as like, nope, this is normal. This is the way it goes. And of course, coming from a male perspective, I don't live that experience, but with my patients, I make sure that they have, informed consent on, yeah, like let's dig into this. With that said, there's also a lot of over testing and over treating and over investigating of these things at times. So it's a fine line, but I think it's a personal one.
Okay. So let's dive into that because I think, like, for my journey where I'm right now, and I think what a lot of women can relate to is like we're feeling all of these symptoms or we're noticing all of these changes, and there's not a lot of explanation for it.
It just depends on how deep you're trying to dig and if you're actually trying to pursue fertility or if you're just trying to pursue kind of optimization or kind of like a biohacking approach. Sometimes, sometimes traditional primary care and OBs will be, a little bit put off by that depending on how open they are. We have a wide spectrum of approaches to this and the integrative medicine piece. And it is exciting because the NIH and the FDA just removed a black box warning from, hormone replacement therapies, and that probably should have been done a long time ago. We have individuals in the integrative and naturopathic medical space that have been um, really ahead of the curve on prescribing hyper individualized prescription for um, estrogen, progesterone, and hormone related therapies. So if you're able to find somebody that's really keyed in on that, then it can be game changing for what you're going through, whether it's sleep changes, cycle changes, headaches, brain fog, all of the things that tend to come up um, associated with the cycle anyway for women, whether they're premenstrual or just generalized menstrual symptoms. But as women approach menopause, they tend to worsen, or they tend to kind of localize into different buckets. Like something will get worse. Like all of a sudden you have insomnia that you never
Mhm.
had, or you have, obviously the common ones when you get closer and past menopause are the vasomotor symptoms, but everybody knows about that. Like hot
Hot
flushes,
flashes, yeah.
hot,
Vasomotor
hot
symptoms like
flushes
temperature.
and
Yeah.
right. And things like that. Those are very pathognomonic for menopause. But ahead of that timeline, there's I think they've done some studies on this, and it kind of correlates with the spectrum of symptoms that women have during like premenstrual symptoms
Mhm.
that women have. And the list is literally like hundreds of symptoms long.
When I was going through my blood work, a little bit anticlimactic because
Mhm.
everything, for the most part, aside from one or two things, fell
Mhm.
within range. We also looked at it from the cyclical perspective. So
Yeah.
can you like,
So
what's the perspective behind that as well? Because I think there's the functional medicine approach and then there's the medical approach. And it's not one or the other. It's kind of like, how do we bridge the gap? And I think the functional medicine side is probably not the one that comes out the most because it's still considered extra. It's not included in the benefits. It's not the thing that you get
yeah.
from the cookie cutter
Right.
medical primary physician.
Yes. Anytime you ask for lab work, it costs, the insurance money.
Yeah.
So when doctors are making an order for something, unless you're paying out of pocket, they're always considering like, is there a chance that this person has an actual pathology that we're looking for?
Right.
And when we talk about the menstrual cycle and women's hormones, it's almost never pathological, literally almost zero.
Pathological.
Pathological meaning like you have a truly like uh primary hypoandrogenism, like you have some sort of condition with the ovaries not creating hormones
Yeah.
and you're low. You have a pituitary tumor and you have prolactin is high, so it's suppressing all of your hormones.
Like,
That list is also long. I just
okay.
gave a couple
Yeah.
examples, but those would be ones that would stick out. Like, at the end of the day, do you have also like polycystic ovaries? Like, yes, like that's also common too.
Mm,
So that can affect
PCOS,
can
right?
affect blood work. Right, exactly.
Right.
So outside of that, so that's why you get a little bit of pushback. Is like, what do they expect to find? Typically, they expect to
Right.
find nothing,
Right.
and that's what we found for you. Standard panels are usually they're truncated, they're minimized. So functional medicine physicians and integrative doctors and naturopaths, we tend to extend those panels to include things that maybe aren't traditionally tested for financial reasons, but also for insurance reasons. So
Okay.
we went back and we just added a few of those things, but it wasn't like it was.
There were like 16 different
Well,
biomarkers, and
some of them
I
are
already had
repeats,
20.
and
Oh, yeah,
some of them
that's
are
true. They were
repeats, right?
repeats. You're right. Yeah.
And this also goes to the fact of like, why would why would someone that's not trying to get pregnant or not having fertility
Yeah.
problems or doesn't have overt pathological symptoms, why would someone go 3 to 4 times a month just to get their hormones tested to see their like hormone curves? And so
Yeah. Let's
that's
just explain that because so we did it on a cyclical basis. I had day 10 and day
day
21.
21. Yeah. Right. And you would, if you were really tracking the cycle, you would add day 3 and day 14. So very like specific things tend to be happening at those specific days in the cycle. Without going down the rabbit hole, someone who's evaluating your fertility and your ovarian reserve and your ovulation status, like we would like to see, those particular days typically.
Okay.
A lot of tools, but one of those tools is specifically blood work. So why would someone hasn't gone through the phases of like, oh yeah, I've been trying to get pregnant for
Yeah.
12,
Someone who is
12 months.
experiencing menopausal symptoms.
Yeah,
Why
but
would we go through that
yeah,
testing? What's the
exactly.
value of it?
That's a good question. So sometimes we're trying to look for nuance
Right.
in the blood work to give us a beat on, oh wow, okay, they're at day 21 later in the cycle. There's a bigger spread,
Mhm.
maybe then of estrogen to progesterone ratio, What is that doing? What does that mean? It's really not necessarily conclusive via really like hard, strong, evidence thus far. And once again, I think every woman, tends to experience those ratio changes different, although there are commonalities. But that's that's what you would do if you were trying to see some of the nuance in your cycle to inform, okay, would it be advantageous to add some sort of hormone therapy, whether it's like estrogen or progesterone or a combination, topical, systemic, at like during the full cycle or during parts of the cycle? What's going to, change the needle? And the American Menopause Society does have guidelines on all of those things, but they also have a guideline that talks about non-hormonal
Right.
approved and well-studied therapies for things like vasomotor system symptoms and hot flushes and sleep and insomnia and stuff like that. So that tries to encapsulate, like, why would somebody do that? Is it a waste of time and money?
Yeah.
And the answer is not necessarily, but you may not find anything particularly, like you said, you may not find anything particularly mind blowing
Hmm.
in at least the first two sets of labs that we did, which is actually a good encapsulation, like day 10 and day 21. You can get a good bead on like the front end of the cycle and the back end of the cycle to see what's happening. But there is also a lot of over testing. I tend to sit in the bucket of just making sure patients are well informed. Like, are we going to find something? We may or we may not, but we can also treat empirically based on your symptoms too,
Mm.
if we don't come up with something. So we could, how if we don't find anything in your blood and blood work necessarily, but you're like, there's like a huge matrix of options that people can do.
Right. Going back to what you said originally, everything should be individualized. I do feel like, for me anyway, I want to have some biomarkers before I decide to make choices about putting new things in my body, whether it's,
Hmm.
what was the thing? The brain fog.
Yeah.
Literally, I'm literally blanking out right now.
What was it? What are you talking about? Oh, an
Oh, an
IUD.
IUD. Yes. When
Yeah.
she said you can get an IUD, but she hadn't tested anything. And she was like, yeah, you're not going through perimenopause. You can just get an IUD. And that doesn't feel great because you haven't really given me many answers. And then being able to then get a deeper picture of health. I uncovered things like cysts and what did we uncover? Like mild thyroid dysfunction.
Hmm.
Then you have to decide which symptom am I going to treat or which direction am I going to go with this. And an IUD might not have been the right choice.
Yeah, you just have to do your value proposition. There's
You
always
do.
risks with that for sure. And so, but I mean, that's those types of implants are or oral contraception are clearly an option for
For
some
some people.
women. Um, but yeah, going back to something you said, like you're not going through perimenopause. In some ways, I think there's been a bit of a hyper correction in the way that's like extended out this talk of perimenopause to be the 10-year window before you actually start before your period starts to change,
Yeah.
and before you start to get intercycle bleeding and longer periods, worse periods, heavier periods start to disappear, skipping periods. Like that's really the kind of the definition of perimenopause, basically, as it stretches. um but it seems like that particular time period of perimenopause in recent years has started to be scientifically, but also culturally stretched.
In terms of
Like,
what we think it is, interpreting it is, or
well,
in terms of what's actually happening in women's bodies and what we're seeing.
it's almost like a phenomenon. I'm sure I'll rub people the wrong way, but um, there's been a lot of discounting of symptoms in the past by men on women, by the medical industrial complex, and through research. A lot of the research, has always been on men, and then the research on women done poorly or reported poorly. Women's Health Initiative included. Um, lack of accountability for those advisements over the course of recent decades, and so there is this transition time for women that's becoming more and more apropos to discuss, but the medical complex is lagging.
Right.
So they're kind of lagging in like, oh, went to the doctor and like I was started to talk about perimenopause and I'm 41, and the doctor was like, "What the hell are you talking
Well, yeah,
about?"
that's exactly what
So
happens.
we certainly don't want that to be happening, but we also don't want to be pursuing like overly testing and once again overly treating if you do have a regular period and if you're overall generally well and if you have intermittent and non-specific cyclical symptoms. But we also can make your life a lot better if you do decide to test for the nuance and test and don't guess,
Yeah.
dig into the numbers and find somebody who's willing to go on that journey with you. um, and also experiment with what is going to work best,
Mhm.
because it's not, yeah, it's, once again, it's not cookie cutter, and you might go through several iterations of what you try. But with the safety profile and with careful dosing, it's almost just like taking a supplement like you would take out of your cupboard and buy off of Amazon and not think twice about it. If you not think twice about the safety, which we should do more about, because
Yeah.
products coming from places where they're not tested, et cetera, et cetera. These hormones are rigorously produced and tested, and they can be utilized in a transformative way
Hmm.
for women, in a nuanced way. So we do I do quite a bit of that. We do quite a bit of that at our clinic for female patients. We are even um, digging into the nuance of like how to do that with different types of um, female specific cancers, and like
Oh, wow. That's interesting.
that's a whole nother rabbit hole of safety and issues,
Yeah.
obviously.
So the
Yeah.
removal of the black box warning on hormone therapy has sparked quite a bit of debate. What's your perspective on how it's going to change women's health?
I don't think it's going to change much. I mean, there's been a big shift since there was a lot of pullback from HRT because of that study, but there's been a complete paradigm shift, I'd say, even within the last 10 years or so, just that kind of reversing that trend. And so it's not new. People, practitioners have been acting as if that black box warning is worthless anyway. At least in my particular um, type of practice, people should still understand that there's risk. So obviously, with things like it's not exclusive to women either. I think the things like testosterone and TRT therapy for men, across the board. Yeah, you have to be cognizant of what your risk is. And if you have a history of cancer in your family, I mean, you can also pursue things like, genetic marker testing that can inform you to say, hey, like if I take exogenous estrogen and I have this specific gene mutation, is that a good combination?
Yeah.
But you have to
Yeah.
talk to somebody who is trained and understands what that means for you, and what it actually does to your risk profile, and depending on your age.
Hmm.
So usually what we're looking for is the minimum effective dose of all of these things, whether it's estrogen, progesterone, et cetera, testosterone, to make significant change. So that you're not hyperdosing somebody, so you're not, potentially fueling an estrogen sensitive cancer. But once again, we can't know everything about your body, and we can't know every way that it's going to react.
Yeah.
But that's just why you have to test and surveil and do things in a way that's guided, and my boss and mentor would call it elegant. You need to
Yeah.
you need to do it in an elegant way.
Yeah. I like
Yeah,
that.
yeah,
Women deserve elegant care.
that's right. I believe that's true for sure.
I feel like if I were to step back and just go, okay, is it worth it? I think my answer is yes, because I still love knowing what the deeper picture looks like. Um, and then if it's not, and you don't really feel like that's a value to you, then, don't do it. But don't be afraid to ask the questions
Mhm.
based on what you really feel you need to know. And don't be shot down by someone questioning your symptoms and saying
Yeah.
like, because I've had multiple people say like, well, why do you want a hormone panel? Or like, you're not going through perimenopause.
But
So
also anything that's markedly new. I mean, a lot of women have once again a spectrum of cyclical symptoms throughout
right.
their life,
Yeah.
and it's it, only you know your body best, and then kind of tracking those changes, things can either subtly or markedly shift. And if it's 5, 6, 7 months on, 8 months, and you're getting kind of repeat or consistent shifts in that cycle, then we tend to know that something's changing, right? So something's happening. So you can't be stalled on that, but certainly democratization of testing too. Like you can go and get these tests out of pocket. You can go to a LabCorp and just basically like pay for them. And also there's, third party health and functional blood work testing companies all over the place. You can find a way to get tested should
Right.
you.
And is there a blueprint of what you should test for after a certain age, or if you feel like you're going through perimenopausal symptoms? Different.
Yeah, I mean, there's definitely like some core lab work that would cover the bases, and um, you could do well with a short list. It's not extremely long, but it's effective to track.
Yeah.
And so ultimately, there are options. There's value in knowing, even if it doesn't show you anything remarkable. Um, there's also option. There are also options, plenty of options to treat symptomatically
Mhm.
for women too, with a very, once again, nuanced and elegant fashion. Um, and we're doing a lot of that in our practice, which is amazing. It can be a game changer for people, and I encourage people to just pursue that conversation um, whenever they're ready.
I love it. Okay, so statistically speaking, what are some of the markers that women can look at in addition to the hormone piece after the age of 40 that would be useful to track to maintain energy, day-to-day function, to be able to feel like they're thriving in their daily
hmm
lives?
Okay, that's a good question. So, just to pare it down to a few key buckets. I mean, you want to cover off like thyroid issues in women is a bigger problem than men. The statistics support
Mhm.
that. So cover off the thyroid. You don't have to go test it every 3 months. That's not the point.
Unless you know you have something specific, unless it's
Yeah, well, you
pathological.
should. Well, right, right. Unless you do find something that's indicates for more testing or for some imaging or something, then
Okay.
that would happen. But cover off the thyroid, see how that's functioning. That's like the main one of the main drivers of metabolism, and people with
Mm.
thyroid disruption, especially hypo on the suppressed side, are going to feel like absolute dog shit. So
Right.
you're gonna feel tired, brain foggy, depending on the heaviness of your periods and what your complete blood count like looks like. You want to be covering off for anemia too, whether it's iron deficiency anemia or other. Um, and that's typically done strictly through a CBC. So you don't need to go get like an advanced iron panel. You don't need that.
Mm.
Is it nice to have sometimes? Yeah, sure. Um, but you don't need it. We can look at a CBC and say this person likely has iron deficiency anemia because they have also concurrently heavy, periods.
Yeah.
Um, and match the two together. Okay, what are you going to do about it? Whether it's dietary change or iron supplementation, etc. Um, Other things include inflammation markers. I think that's a big one. So thyroid, CBC, iron status, and then inflammation, things like C-reactive protein, uh, ferritin, these what are called acute phase reactants. So if you're constantly high in these, we know that you're constantly battling some sort of inflammation, whether it's chronic infection or you have environmental exposures or mold. So we have a few key inflammatory markers that you would do well to track semi regularly, and then be advised on what to do about it.
Mhm. Okay.
So we're all exposed to the environment. So maybe it's mold. Maybe you haven't changed your pillows, your sheets, or your bed, or you're living in a particularly dusty, moldy environment that can keep your immune system inflamed,
Yeah.
like upregulated and inflamed. So the last one would be like some sort of a cortisol adrenal function assessment. It's definitely not standard of care, the whole kind of adrenal fatigue, which is
Yeah.
not it's not
The air
it's not a
quotes.
real diagnosis, but it does express itself in hypofunctioning adrenals, where we get a diminished or absent cortisol awakening curve, meaning when we wake up in the morning, we're supposed to have like a boost of cortisol that's supposed to wake us up.
Right.
It's supposed to peak up within a short time period after we wake up. And then it's supposed to start to diminish as you go through the day, kind of into the afternoon. And then it's supposed to have like a little blip back up, uh, before it decreases again around
Mhm.
bedtime. So it's kind of a biphasic curve in cortisol. But the biggest, most important one is what happens when you wake up. If you're the type of person that when you wake up and you feel like you're dragging your ass for the first 3 hours of the day,
Mhm.
you may not be getting that like net, because the cortisol bumps up and it also peaks up um, energy. It's like a little adrenaline boost. And so it if you have it. If you're the type of person that like gets up, moves around a little bit, takes a shower, and then within the first 20 or 30 minutes, you're like, okay, I'm ready.
Yeah. Yeah.
Like, even if you haven't done any sort of like movement or been outside or whatever, if you don't feel that within the first little bit of the morning and of the day, there's a chance that your cortisol is suppressed and you're not getting that. Obviously, there's other factors to
Mhm.
consider, like are you sleeping? Are you sleeping well, etc. But all things held the same, that's another one to look at. It's a little harder to test, but it's like typically a saliva test
Mm.
that you do at various time points in the day. And this is kind of on the edge of, certainly on the more integrative medicine side. A lot of standard of care are not doing this, but it's an evaluation of your adrenal function, and so then we can intervene at various times in the day with different things to help support the adrenal gland. So thyroid, iron status, inflammation, and adrenal function.
That's like a good baseline. And then if someone's like, I want peak performance, like I want to run marathons, I want to do a high rocks, whatever it is,
Well, yeah.
as I continue to age,
Yeah, then you're
what
talking about then
what's
you're
like performance, what's the performance medicine perspective?
if I was going to say a few add-ons to the previous stuff, I mean, you probably would do well with some sort of like an oxidative stress panel, and these
Mm.
are usually done in like kits with specific companies. Oxidative stress panel that accompanies along with like that inflammation, like a micronutrient, panel of some shape or form to get a sense of your nutrient status. That's always a good one to have. Um, so you have to keep it simple first, right? Like there's no reason for you to go do $2,000 worth of testing if you're iron deficient or your thyroid is not functioning
Right.
well and you're inflamed and you're not sleeping and you don't have a proper adrenal function. So I mean, those
Start
things
with
you
the
gotta like for the core,
core four.
core four. If you're eating well, hydrating well, exercising, and sleeping well, you cover off those four bases, those core four, and then also you test those core 4 or 5. Add in the hormones if you're interested. You're doing a pretty good job of tracking, your health.
What could someone who doesn't want to bear the burden of all of this? What's the lightest lift?
Well, once again, if we go back to statistically, many people don't have particularly remarkable lab work, so they don't need to. But what I would say is ask yourself what what aspects of lifestyle medicine can I fix for myself if I have any bandwidth?
Yeah.
Right? Everybody should you should be making it to the doctor at least once a year anyway. Know your status, know where you're standing. um, Especially as we get into our 40s, screening protocols start to come into play. Absolutely, absolutely. Those things you need to make time for
Yeah.
at a minimum. People are telling you, oh, doing all this testing and I'm, testing my labs for this and testing my labs for that, and you don't have the money to, or you just don't care. Just think about like what aspects of lifestyle medicine you can tune into, whether it's better sleep, better nutrition, a little bit more exercise, more time outside, more, more exposure to some healthy sunlight. Um,
You can just basically
yeah.
touch some grass,
And the take
stand in
home,
the
yeah.
sun.
Totally. Totally. I mean,
You
the take
know,
home is not to like, and just don't jump on some sort of like supplement regimen
yeah,
that you
that's
saw
the most important thing.
on Instagram for no reason. Like
Yeah.
like the next person
The
is not you.
supplement quality is also a big
Well,
thing
that's
right now.
another,
We're
that's,
not going to get into it, but I'm just saying, like, don't just jump on the first thing you see because someone said, take this. Yeah.
well, that's right. So that's very fair.
This is a good general conversational overview of how a lot of women are potentially feeling. I appreciate the balanced perspective of saying, like, don't go and do everything. You don't need to go and take every test. You don't need to go and, take every supplement because someone said this is what depletes in your body after the age of 40. There's ways to individualize care, and there's also like ways to phase out that care or phase out that journey so that you're not overwhelming yourself.
Right. Well, I think that's, hopefully there are some tidbits that people can take away and think through, and maybe they will have that conversation to do a little bit more digging, or maybe they won't, and that's fine too.